atrial septal defect, known as ASD, is an opening in the intra-atrial septum located between the left and right atria. The hole can vary in size and close on its own shortly after birth, but other times it requires surgery to correct. ASD is asymptomatic, and if the hole is small, it usually does not cause problems. From this point, it is monitored. If the opening is larger, this creates a left to right shunt. This causes blood from the left side of the heart to go to the right side of the heart, which causes an overload of blood being sent to the lungs. Overload to the lungs often causes complications over time, such as heart failure and pulmonary hypertension and stroke. Some signs and symptoms of ASD are heart failure, pulmonary hypertension, decreased cardiac output, crackles, sweating with exercise, edema, low growth rate, and extra heart sounds. There are 3 different types of ASD. The ostia secundum is the most common near the center of the septum. The ostia primum is at the lower end of the septum. And sinus venous is near the junction of the superior vena cava. This opening is normal for the baby to have in utero because the opening allows the blood to detour away from the lungs and circulate the body. This opening is called the foramen ovale. After the birth of the fetus, the opening is closed once the baby takes its first breath, causing the left side to become more pressurized, needing to send the blood throughout the entire body, thus closing the opening. Most atrial defects occur by chance, but researchers show it may be linked to genetic and chromosomal abnormalities or environmental exposure. Other potential risk factors could increase the occurrence of ASD are obesity, diabetes, and smoking. ASD can go several years before finally being diagnosed. The diagnostic tools used are echocardiography, transesophageal, cardiac catheterization, chest X-ray, or an MRI. Management of ASD can include closure via cardiac catheterization or through an open method with cardiopulmonary bypass. Nursing assessment: assess the O2 status, cap refill, pulse rate, apical pulse, blood pressure. Auscultate the lungs for sounds for crackles, assess for weight gain, monitor ECG for abnormal rhythms, assess the skin for pallor or cyanosis, and assess the level of consciousness. Care for these individuals include plan healthy meals with fresh fruits, vegetables, and whole grains, decrease sodium in your diet, promote activities as tolerated, and provide rest periods between activities.